Hello all of you, welcome back to our channel which is Study Smart with me, and today we'll be going to discuss next series of questions related to anatomy only. So let's come to the questions directly. Which structures are at risk of injury when resecting the free edge of the lesser omentum except for which one? So what you have to tell, except. Okay, now what is the one answer is hepatic vein. Structures in the lesser omentum include hepatogastric ligament, hepatoduodenal ligament, hepatic artery proper, common bile duct, portal vein, lymphatics, hepatic plexus of nerves enclosed in a fibrous capsule which is a Glissen's capsule. But what is not there is a hepatic vein. It's there. It's there. Correct? It's there. So what is not there we are having is this. So this is the diagram, you can go through with it. Now let's come to the another question of it. While observing your orthopedic clinical rotation, when you are going for a clinical rotations and you saw a senior performing a test which is a pen test, it is a pen test, but we'll see when our senior is performing that he is placing his pen higher than the thumb and the patient is asked to touch it. So what nerve or which nerve is being evaluated in this test? Tell me. Yeah, median nerve. Median nerve. Correct? The clinical examination of the median nerve involves motor lesions at the wrist, carpal tunnel, pen touching test. The patient lies hand flat on a table with his palm facing towards. The patient is asked to adduct his thumb to touch the examiner's pen which is held above it. So what is this test? This is a pen test. See, what is testing? Median nerve. Should I write it more appropriately if you really want it? To do so, let's take a red pen. Median nerve. The patient is unable to touch the pen due to loss of action of abductor pollicis brevis. Now this is the benediction test. So I am covering another questions also. Okay. So this is benediction test. Here the patient is unable to flex the index and middle finger on lifting the hand. So these all test is for the median nerve only. For the median nerve. Now there is one more test, pointing index or Oshner's clasp test. You have to know these things. When both the hands are clasped together, index and middle fingers fail to flex due to the loss of action of long finger flexors of the index and middle fingers which are supplied by the median nerve. So which are the tests performed to test the median nerve? Pointing index or Oshner's clasp test, pen test, benediction test. Okay. Let's go to the another question which is image based. All of the following are correct except. Focus on except word. What is the answer now? Yeah, D is posterior circumflex humeral artery. So what is D actually is? What is D actually is? Yeah, subscapular artery. And what are they showing it? Posterior circumflex humeral artery. So answer is this: pectoralis minor muscle originated from rib number 3, 4, 5 and getting inserted into the coracoid process because of the muscle, the axillary artery. Now this is the diagram which is covering each and everything. This is let me take this, subclavius. This is superior thoracic artery. This. Now this is pectoralis minor. This is subscapularis. This is subscapular artery, which is our answer. Posterior circumflex humeral artery is this. Always remember circumflex artery is like rounding like this. Okay, this is anterior circumflex artery and this is posterior circumflex artery. This is latissimus dorsi, scapular branch, triangular branch, lateral thoracic artery is this, teres major, profunda brachii artery, triangular interval, thoracodorsal artery, long edge of triceps brachii. Okay, let's come to another question. In case of injury to the bulbar urethra, urine extravasation occurs in all of the following areas except deep perineal pouch. Injury to bulbar urethra will lead to the extravasation of urine into superficial perineal pouch, not in the deep perineal pouch. Okay, and then down the thigh, urine will also go into the scrotum and extravasated out. If the injury to the bulb of the penis results in urethral injury accompanying 3 years of Pyqs fascia, then extravasated blood and urine accumulates in the superficial perineal space passing into the penis. What is this? Pyqs fascia as well as the scrotum and lower anterior abdominal wall. So you can see this diagram also. Now let's see this last question. Identify the above deformity. What is this? You know this very well. Erb's Duchenne palsy. Erb's Duchenne palsy results from neuronal damage to the upper C5 and C6 nerves. The clinical presentation includes partial and full paralysis of the arm and often accompanied by loss of sensation. Klumpke's palsy causes paralysis of the forearm. Erb's palsy, what is doing? It's doing partial or full paralysis of the arm. Klumpke's palsy causes paralysis of the forearm and hand muscles as a result of the mechanical damage to the lower C8 and T1 nerve. So both of the image I have shared over here, so you can make a difference. This is Klumpke palsy, lower trunk injury, Erb palsy, upper trunk injury. We also say this with a name, Bater's tip posture, and Klumpke is a claw hand deformity. So MCP joints extended, IP joints flexed. What happened here? Internally rotated and adducted arm, extended and pronated forearm, and flexed wrist. You can see this as well. So that's all for this video. I hope you are liking this series, and please do share it with your friends and your colleagues. Stay connected with my channel and do like and subscribe to my channel. Thanks for watching me. Bye bye. Take